Hello, everybody, and welcome. I am Dr. Andrew Neville. Welcome to our live Q&A where we're going to chat about adrenal fatigue and everything it is and isn't. I've got a bunch of questions to be able to go through that I'm excited to talk about. I'm just going to wait for my team so that I can hear if we're actually live. That would be good. So I'm going to wait for some feedback. Welcome, everyone. They're talking to me now. So wherever you are in the world, welcome. We're glad you're here. We're going to talk about all the misconceptions and misunderstandings with regard to adrenal fatigue. So I'm going to answer a bunch of questions. We're glad you're here. I mean, if you're here and you're like most people anywhere, you've tried to get help. Right? You've sought answers, you've tried to get guidance, and have found either limited or temporary or even no change in your symptoms. We get that. We see it all the time. This condition, unfortunately, is mishandled just about everywhere. What you need is accurate information, a personalized guidance, right, and a team to support you through this. Because as it turns out, adrenal fatigue is one of the key underlying pieces of that health and healing puzzle. So we're going to talk all about that. So I hope you have questions. So, as you go through this, if you kind of find yourself nodding along and everything, you're in the right place, right? Keep asking questions, keep getting information. So as you join in, let us know where you're from. Wherever you are, especially international, we've got patients all over the world. And if you are international, if you put in the comment section, if you type in international, you can get some information about the international programs. I just got off a group call with a woman. She's in Singapore. And so, we've got patients all over. Evidently, the U.S. is not the only place that mishandles this condition, adrenal fatigue, which is very real and very problematic. Okay, legally, I have to say this information is for educational purposes only. The content is not intended to substitute for medical advice, diagnosis, or treatment. Always seek the advice of your medical doctor or healthcare provider with any questions you have regarding a medical condition. That said, I'll do my best to answer all of your questions with the backing of my education experience of doing this for 23 years with thousands of patients. So if you're a current patient, welcome. Glad you're here. If you have a question, you can submit it, but you have access to us, to me, or to my team. So if you're, from the coach-led program, Core Plus, or my healing transformation program working with me, you can chat us those questions. But if you want to submit a question, you could submit it, and we'll put it at the end. These conversations are more so for new people, trying to just get kind of that kind of information out there. And I can't get too specific here, here as well. So my team's going to be adding links in the comments to all kinds of useful information, whether that's a complimentary call that you can have, or information about the new Instagram page we have, new information about the Facebook group, Healing Adrenal Fatigue Holistically, where there is tons of support and information and guides and all kinds of stuff. So my team is all over that. So any questions, any comments, if you're live, welcome, submit a question, let us know where you're from, and we're going to get to the questions. So there's a lot of questions. I'm always trying to, connect the dots, and I'll try to get to as many questions as I can. Seems like a lot of these symptoms and conditions are separate, right? But strangely, they're connected, and I'm hoping I can kind of put together a bit of a framework here for you. Lastly, check the comments for all these links, right? So my core program, right, which is my self-led foundational program, self-paced, do it on your own. We revamped the whole thing this year. It's available for the $30 off for attendees today. Okay, welcome. Here we go. Nancy says, I now suffer with digestive issues after being diagnosed with fibro, ME, CFS, what's that other one? EDS, yeah. Finally on a histamine diet with some relief, but not completely resolving. Seems like it started. My stomach is completely wrecked. my sleep and central nervous system now. Okay, is there any end to this? Can it really be reversed? Oh, I'm sorry to hear what you're going through, Nancy. 100%. It absolutely, this stuff can be fixed. The problem is you've got to treat the why. Okay, so you got a diagnosis of fibro, 11 out of 18 tender points, 4 pounds of pressure per square inch. Why? Like, why would that happen, right? MECFS diagnosis, right? Even the EDS diagnosis, the histamine issues that you've had. Why are all these things happening? What many doctors will do is they'll chase the triggers, right? Or they'll chase a secondary condition or a secondary problem without asking the why. So if you have histamine issues, why? Well, you're overreacting to, say, histamine in foods. That part of your immune system that produces histamine is overreactive. Okay, great. Why? Yes, you can go on a low histamine diet, but why is that happening? Well, your immune system's out of control. Well, what controls your immune system? And what that boils down to is your stress physiology. So what adrenal fatigue is really a broken stress response system, not just a problem with your adrenals, right? The adrenals are the end organs, the end of the line. The adrenals release cortisol and adrenaline, which are amazing hormones. I give them a bad rap all the time because of the damage they cause, but they're life-saving. We have to have them at a certain level, but you don't want too much and you don't want too little. But the adrenals don't decide to release those hormones. They're told what to do. So if we go up the chain of command, we got to get to the pituitary and the hypothalamus. Those are two endocrine glands. They live in the brain. So that's your HPA axis. They all talk to each other. But that's only the hormone side of your stress physiology. There's a whole other division of the nervous system called the autonomic nervous system, right? Automatic, right? It's the nerves that control the organs. 2 wires to every organ. One's fight or flight wire, one's rest and digest wire. They should be in balance, but most of my patients are stuck here. Too much fight or flight. Well, neither of those systems call the shots either. At the top of the HPA axis, at the top of the autonomic nervous system, there's the decision maker. It's called the limbic system. So this is not a thinking part of your brain. It's just a reacting part of your brain. And it's there to assess danger. It controls some basic physiology too, but it's there to assess danger, right? It receives a stimulus and says, all right, is this stimulus, this thing, harmful, dangerous? Can this thing kill me? Do I got to jump this body into fight or flight? Boom. Hormones, nerves, turn on the heart, the lungs, the metabolism, shut off the immune system, shut off the reproductive system, shut off the gut, shut off the thyroid, right? So we do that. And it saves our life if you do it temporarily. But if you get stuck in a situation because of genetics and because of stress over time, that limbic system gets trigger happy and it gets wound too tight. Now we start over perceiving our environment as dangerous. Now we end up stuck in fight or flight. A lot of you know what that feels like, right? It feels like wired and tension and stressed and easy overwhelm and pain and fatigue. And this sensitized limbic system is now triggered happy, over perceiving our environment as stressful. We now fill up our bucket faster and faster, and now we're just stuck here. So what happens then is we create excess wear and tear on our body, and we suppress the rest and digest, the healing and repair side of our physiology. We also suppress our immune, digestive, reproductive, thyroid. You'll notice that theme. Stress hits the immune system, causes the immune system to get flared, and you see histamine problems. When you treat that control center, right? That broken stress response system that we'll call adrenal fatigue, but the whole thing, when you treat that, you can shift your physiology back into balance and not have to deal with these histamine problems anymore. Not have to have the chronic pain, which also comes from central sensitization, central for central nervous system. This is why a lot of my patients, right? They're sensitive to like bright lights, loud sounds, harsh chemicals and smells, and even touch, right? You could touch one of my patients and the brain registers pain. Why? It's sensitization. Those stress hormones hit the nerves and make them all trigger happy. So there is absolutely a way out of this, but we can't chase the symptoms. You can't chase the names. CFS and fibro, these are like diagnoses of exclusion. I can't figure out any other reason why you're tired. Must be chronic fatigue syndrome. They don't know what to do with that. I can't figure out any other reason why you hurt all the time in weird random places. They don't know what to do with that either. We do, because there's an underlying physiologic cause. That's what we have to fix, and you absolutely can. And what I would encourage you to do is, if you're new to this, maybe go to my YouTube channel. I talk about this stuff constantly. There's hundreds of videos on there talking about all these symptoms and this interconnectedness. There absolutely is an answer. And if you want to reach out and talk to somebody, you can get a complimentary call. Just put a comment down here in the comments and reach out to us. There are ways out. So I want you to hold on to hope. Okay, Nancy? Kay says, is thickening of the adrenal glands a result of adrenal fatigue? Is there a way to reverse the adrenal thickening? So when Hans Selye, who brought the word stress into our kind of common vernacular, back in the mid 1900s, he wrote his book, Stress of Life, I think 1956, something like that. So he tested rats. And when he would stress his rats, no matter how he stressed his rats, they would get sick. They'd actually develop adrenal fatigue, believe it or not. Their thymus, which is main part of your immune system, creates your T cells, would atrophy. Their adrenals would swell. Now, I don't know if he biopsied them. I don't know if they thickened, but they would swell. And they developed ulcers, right, because of that digestive suppression. Whether he gave them toxins or he overexercised them or a virus or a little surgery or whatever, like no matter how he stressed them, they all developed that same problem. And this is where we get this bucket concept, where no matter how we stress our body, it all goes into the same bucket. We only have one stress response system, right? Limbic system in the brain, hormones, nerves, just got to respond to everything. So it all goes into that same bucket. And it's when that bucket fills up, that's a problem. So what can I say, Kay? It's possible. What you might want to do is go to my website, go to the symptom assessment quiz, 4 or 5 minute quiz, really easy, answer some questions, and it'll give you the likelihood as to whether or not you have adrenal fatigue. So it's possible. It's possible. Lisa says, hi, Dr. Neville. I am a young 56-year-old. I love that. Good attitude, Lisa. With celiac disease, PTSD, chronic pain, blood pressure, postmenopause. I eat healthy most of the time, try to stay as active as possible with my injuries, brain fog, fatigue, insomnia, hot flashes, overweight. I get it. Dieting and medication seem to be unhelpful or only temporary solutions, for sure. I'm tired of spending money on things that just don't seem to help. What else can I do? Well, Lisa, I would say, hopefully you're here. This call is being recorded. I kind of just answered that a little bit, but in the first response to Nancy. What else can you do? Diet is a part of the treatment. So what I have to do with my patients is figure out what is their therapeutic puzzle look like with regard to this problem. I'm not talking about ancillary problems, secondary, tertiary issues. I'm not talking about symptom chasing. With regard to this broken stress response system, everybody has a certain therapeutic puzzle. And what my team and I do is we put these pieces together for each individual person. There's some core central pieces of that puzzle, and you'll hear me talking about those things. Even today we're going to touch on those. But even those pieces, the orientation is a little different. The size, the shape's a little different. It is different for different people. And that's what we do in our programs, is kind of help people guide and figure out what that puzzle looks like. Now, so what else? There's a lot, right? The puzzle. Oh, if this was easy, I guess I'd be out of a job and everybody be doing it. What we have to do together is we have to shift this physiology. So by the time you get to this place where you've got all the pain and the blood pressure and all the PTSD, all this stuff it's the same, right? It's all coming from this same problem. By the time you get to that, your body is stuck in stress physiology. So how do we shift this physiology? We got to create space in the bucket. And there's 3 ways to create space. You want to scoop some stuff out. Your whole life is in that bucket. Past, present. It's all in that bucket. Physical, mental, emotional, chemical, environmental, toxins, traffic, arguments, relationships, head injuries, past trauma, abuse, jobs, death in the family. Like it's all in that same bucket, right? So we have to scoop, right? We have to scoop. And this is kind of what we talk about, right, through the programs. And my programs are months long, right? So you're going to get a 5-minute answer. I'll do the best I can, but this takes a little work. So we scoop whatever we can out. Not everything. You don't have to empty your bucket. That doesn't exist, right? So then we learn to poke as many holes in our bucket, right? And we learn like relaxation exercise or breathing exercises or vagus nerve exercises or coping skills or cognitive behavioral therapy, all these various things, right, to poke as many holes in the bucket. And then we make the bucket bigger. We expand the bucket. So by healing this broken stress response system, that's a little more our job. Heal that system, you can make it bigger. All those actions create space. When that creates space, now you have tolerance to your world. Now you're not so trigger happy, and we can loosen up this stuck physiology. And when you loosen that up, ultimately what happens is as you turn off the wear and tear that comes from stress physiology, your symptoms decrease. They decrease in intensity, frequency, and duration incrementally. And then you turn on the healing and repair side of your physiology, and your body fixes itself. Our bodies know how to heal. They really do. It's one of the things I teach my patients. Our bodies know how to heal. Our bodies have been healing for thousands of years, but they're not going to if that part of our physiology is turned off. And that's what happens in fight or flight, right? We've got to shift this physiology. So this is what we talk about in our programs, whether it's with my coaches or with me. But both of those programs actually start with my core program. So I mentioned the core program. We revamped that this year, made it so robust, so strong. And it is powerful, and it is the foundation of everything that we do, right? I have a hierarchy as to how I treat patients. And, we talk a lot about lifestyle issues, relationships, mindset, exercise, too much, too little, right? Movement, everything. Again, relaxation, exercise, nature, and all these various things, right? We talk about diet. There is a way you need to eat if you have adrenal problems. We talk about balance and general support, and we get to supplements and vitamins and things, but supplements don't fix this problem, right? And despite what everybody says, and there was an article written about adrenal fatigue 15 years ago, and everybody regurgitates the same article that's out there. It doesn't work. Supplements don't fix. You can't take a little vitamin C and fix everything I just described. Do I use vitamin C? Of course, but it is supplemental to all this other work. And that work starts with core. And I would check it out, right? I would check it out. If you put core, right, core in the comments, they'll get you a link. That program is profound. Check out the testimonials, the reviews on simply about core. There's probably something here. I don't know, but there's probably something going to show up here. So there's a lot else you can do, Lisa. Don't give up. Keep asking questions. Go to my YouTube channel. Reach out if you need help. Okay, Dina says, when you have mold toxicity and adrenal fatigue, do you need to get mold detox first and then the adrenals slowly come back? What's the best way to support the adrenals and detox? A great question, Dina. Okay, if you're living in an active mold environment, get out, fix it, don't do that. But if a doctor has diagnosed you with mold toxicity and said, this is why you have adrenal fatigue, question that. Question that. Ask, why did I react to this mold and, my sister didn't, my husband didn't, my children didn't, right? Why did you have this problem? Same thing with Lyme disease. Why did you develop chronic Lyme disease and a lot of other people don't? Why did my Epstein-Barr virus reactivate and nobody else's or other people don't? Why did you develop long COVID and somebody else who had COVID didn't? The virus is the same. The toxin is the same. The problem is us. And then usually what they'll do is they'll blame it on genetics. And whenever somebody blames something on genetics, that is pretty much a cop-out. That is pretty much a cop-out. So we're looking at this bucket, right, Dina? Mold is there. I'm not saying mold is good. I'm not saying you might not be mold toxic. But why did you react to the mold and somebody else didn't? Because your bucket was full. So if they found mold, right, in your body, it was just a layer in the bucket. How much? I don't know. But what set you up for having the reaction to the mold was this broken physiology. So when we're in fight or flight, maybe, I'll say this maybe, take the symptom assessment tool. But if somebody found adrenal fatigue and mold toxicity together, if they found both of those things, treat the adrenal fatigue, because you might not have to worry about the mold. The body knows how to detoxify by itself. It really does, but it's not going to. That's a maintenance thing, right? That's a healing and repair thing. If your body's in fight or flight, you're not going to do that very well, right? This alters your immune system. It alters those reactions. So I get it. A lot of functional medicine doctors will say, oh, this is causing your adrenal fatigue, right? And I completely disagree, right? Is it part of what's in the bucket? Sure. You can make a living chasing after stuff in that bucket, a decent living, right? I want to fix the bucket. Fix the bucket, make the bucket bigger, create space, create resilience, and then you don't have to go chasing after all these things. I know what's out there. I know how other doctors treat this problem. I see it all the time. I hear it in the conversations with my new patients. I got a new patient coming in tomorrow. She sent me in so many labs, right? So much stuff from all these other doctors, right? I have this, I have this, I have this, I have this. Why? And then ask one more why, right? Because if you keep asking why, you will invariably get to this broken stress physiology. We call it adrenal fatigue. It's way more than that. And if they deny the adrenal fatigue thing, I mean, conventional medicine denies it. They don't understand it. But if functional medicine doctors deny it or minimize it, they don't understand the true nature of what it is. That's key. That's key. And good luck. No matter how you go forward, good luck. Sandy says, I'm currently in core and progressing it very slowly. I noticed that a supplement given to me last year by my local preventative doc help balance my pre-diabetic status, contains milk thistle and other things. Could this be contributing to digestive problems? I heard your comments about oversensitivity, avoid detoxes when healing. Okay. Thank you for all you do. Now I know there is hope to truly heal. There is hope, Sandy. Good. And I'm glad you got that message. Milk thistle is a pretty benign herb. It's not something that aggressively detoxes, right? So in general, I don't mind milk thistle. It's not like, doing some aggressive detox thing, detox the cell or whatever kind of thing. So it's not like that. I don't know, milk thistle wouldn't be my choice if I was going to work on pre-diabetic stuff, right? The big thing is, so if you've got adrenal problems, you've got a blood sugar control problem. That's what the adrenals do, right? That's what cortisol's main job is to raise your blood sugar. It's going to raise your blood sugar if you miss a meal, or it's going to raise your blood sugar if it perceives a threat because it thinks it's a tiger and it thinks you need fuel right away. Right, so there's two reasons to raise sugar in the blood. The threat, of course, right? And then if your blood sugar starts to drop. So, anybody with adrenal problems needs to eat a hypoglycemic diet, right? Small, frequent meals, more protein and fat, low sugar and carb, everybody. On top of that, there's some other things I might use if somebody's moving down this. There's a continuum that I see with patients with what I would call adrenal hypoglycemia, which is more reactive hypoglycemia, but adrenal hypoglycemia, that can transition into insulin resistance, metabolic syndrome, prediabetes, and eventually type 2 diabetes. I mean, we've never had somebody continue on that continuum, so we move everybody back. Partially diet, sometimes supplements. I tend to be fond of berberine. When I have patients in my program, I try to make one change at a time. And oftentimes if I'm using a supplement, it's I tend to stick with single ingredient supplements quite often because I want to know cause and effect. My patients are sensitive. Anybody with adrenal problems you're going to be on the sensitive side. So one thing at a time. When a supplement has a bunch of different stuff in it and something happens, what were you reacting to? You don't know. So I can't answer your question completely there. Reminder: core is normally $497 for core, which is the foundation of my work. So what I've done is taken all the advice I've given to patients who used to come and stay with us at our guest house here on our property. People come from all over the world, and they'd stay for a couple weeks, a couple months to fix this. Well, most people can't access that level of care. I just told the story in one of our group sessions. We had a woman from New Zealand. She came stay with us for 6 months. She was here, incrementally getting better and better and better. Well, that's hard to find 6 months. It's hard to find the funds to pay for that 6 months. I get that. I don't like that money holds people back for getting care. So I started documenting all the advice, the recommendations, the guidance, what healing looks like, all that information, where these central pieces of the puzzle, where to start with this, what's the foundation. I documented it all. That is what is in core. And core is the foundation of everything we do. All of the programs start with core and doing this work. So $497, but if you check the comments, there's a code for $30 off. It's worth it. Worth every penny. Okay, good luck, Sandy. Fabrice says, can the presence of ketones in the urine with normal fasting blood glucose be a sign of adrenal fatigue? So normal fasting blood glucose means you don't have a diabetic ketoacidosis, which would be something we would worry about. If you're diabetic, you can't process the sugars, so you process fats, and that's where the ketones are breakdowns of fat. No, I wouldn't make the connection between those two things. Ketones can go up here and there if you're on a more like ketogenic diet or a more protein and fat rich diet. That's probably the most common type of a connection. Yeah, that would be kind of where I would be. So any one of these symptoms, a lot of people will ask, well, can this be adrenal fatigue? Can this be adrenal fatigue? Can this be adrenal fatigue? And the answer is maybe to a lot of those. We want to look at the conglomerate of symptoms, right? So again, my website, symptom assessment tool, right? 4 or 5 minute, answer a bunch of questions. It'll tell you the likelihood of having adrenal fatigue. With adrenal fatigue, if it looks like a duck, quacks like a duck, walks like it, we kind of know we're dealing with a duck. So look in the comments, symptom assessment, and click that link and check that out. Because so I've checked that out, Fabrice. Anonymous, is adrenal fatigue the same as a dysregulated nervous system? By the letter of the law, no, right? Because adrenal fatigue, say, is just about the adrenals. But by my definition, it is associated. Is it the same? No, it's associated. So when we say dysregulated nervous system, and this is pretty popular, right? A lot of people are talking about, I've got this dysregulated nervous system, got to fix that. And you do. When they talk about the nervous system, they're often talking about the autonomic nervous system, right? My autonomic nervous system, balanced, sympathetic, parasympathetic, I got to turn on my vagus nerve. And they're right, but not only. That's only one leg of the stress response, right? We got to look at the hormones. Right. So some doctors will say, it's the adrenals. We got to treat the adrenals and focus on the adrenals. I'm like, okay, you're right too, but not only. And then some doctors will even focus on just the limbic system, right? Take MRIs and pictures and, hey, we got to fix the limbic system, right? I got a program to fix the limbic. Okay, you're right too, but not only. So what I find is that when you fix all three parts of the stress response system, which work together, you cannot have a problem in one and not the other. And when you tackle all three of them at the same time, that's when you can get some movement in this physiology. It's the most effective way to shift this physiology, not just doing some somatic exercise. And those are fine, right? They're okay, but there's more to it, right? There's more to it. They're just missing, other pieces of the puzzle. So you might as well treat it all at the same time. And And that's what my trilateral method does, right? So if you've looked at any of my information, I talk about this trilateral method. It is tri because it fixes all three parts of this stress response system, which works together. You have to treat it all. If you miss any one of these things, you're not going to make very much progress. Yeah, so I guess not the same. That would be my final answer. Final answer. Roseanne says, I'm stuck in fight or flight. Could there be something causing this besides adrenal fatigue? Pardon me. Are there certain labs or other tests that we should have done to see if something else is going on? Oh, I'm stuck in fight or flight. So if you're stuck in fight or flight, then you have adrenal fatigue. Because if you're stuck, fight or flight is stress physiology. If you're stuck in stress physiology, you have a broken stress physiology. What a lot of people want is the smoking gun. Yeah, but why? Why? Is it the mold, right? We had that question earlier. Is it the mold? Is it the Lyme? Is it my past trauma? Is it the abuse? Was it my childhood? Was it my head injury? Was it the mercury toxicity, right? We chase after all this candida, the Epstein-Barr infections, all this stuff. Like that's what they want to chase. I want it to be something. Give me the smoking gun. And I get it. It's human nature. The vast majority of the time, those are just things that are in your bucket. And this bucket, again, your whole life is in this bucket, past, present. It's all there. 5% of this, 3% of this, 4% of this, 2% of this, 1% of this. Maybe you're lucky and you get a 10%er, but generally it's layer upon layer upon layer upon layer upon layer. I mean, you can spend a lifetime chasing after those layers. Now, what happens? Everybody, we read these stories on the internet. Oh, I got my amalgams out and I detoxed from mercury and I was better. And now I'm healthy. And now I have a program that I'm going to, because everybody must have mercury toxicity. That's what's causing all these problems, right? We make that mistake that just because it worked for you, everybody with this stuff must be. Maybe that person, 50% of their bucket was mercury. I've never seen that person in my practice, but maybe it can happen. Vast majority of the time, it's layer upon layer upon layer upon layer. Now, I field patients. I am fortunate that my patients, to a degree, I'm fortunate. My patients are unfortunate. They've had to go to a bunch of different doctors. They've been to conventional doctors, right? They didn't know what to do. Labs were relatively normal. They went to functional medicine doctors, alternative medicine doctors, and they tested them too. And they were nicer about it. And they picked up a couple things. Hey, you got a little SIBO or you got some stuff going on. All right, well, maybe we'll treat that. Again, SIBO is just another layer in the bucket. So they've got a bunch of tests and I review all those tests and, they're still in front of me, right? My patients are still in front of me. So, if they even found something and they chased after it, they're still not better. Hey, your thyroid's a little off. Let's get you some thyroid. Okay, great. I've been on thyroid for 3 years. I'm still not better. These are all results of this underlying problem. Stress physiology suppresses your immune, digestive, reproductive thyroid. So, yeah, that's my take. Good luck. You can fix it. You can fix it. You just got to keep putting pieces of the puzzle together. You can fix it. Okay. Lena says, oh boy, am I being too long-winded? Probably. That's what I do. Lene, Lene, sorry, I don't mean to butcher your name. So thankful I found you and everything you share. You're quite welcome. Struggling with ME/CFS, 15 years, also hypothyroid. Of course, right? Hypothyroid. Took your test. No doubt I have adrenal fatigue. And I thought I might try intermittent fasting for SIBO and stomach pain, and it helps. Right. You don't want to do intermittent fast. Now I'm struggling so much with feeling low blood sugar. Have meals every 4 hours. But I feel hypoglycemic. When I eat, I feel better, but I test my blood sugar and it's normal. How can it be? Okay, so true hypoglycemia, where your numbers are low, is actually pretty rare. That's a liver disease, and it's extremely rare. What you have is adrenal hypoglycemia, or some people call it a reactive hypoglycemia, where your numbers can be the same. And sometimes it's just the relative difference between the numbers. Like I've had diabetic patients where, their fasting blood sugar is 200. They can feel hypoglycemic if their blood sugar gets down to 150, and it should be 60 to 100. So it's that relative drop. So it's still the same. It's still hypoglycemia. And you want to eat, right? So a hypoglycemic diet, we all have to eat small, frequent meals, more protein and fat, low sugar and carb. And if your blood sugar drops before your last meal, you go back. This is stuff we talk about in our programs all the time. You go back to that previous meal. Did I go too long without eating? Did I have too little protein and fat, or too much sugar or carb? And that's why my blood sugar dropped, right? It's going to be one of those three things. So you got to learn from it. Monitors are okay, but you got to listen to your body, right? That's another one of the rules of thumb. Second part, after listening to you, I know I should eat more frequently, but my stomach pain's always coming back. I have to say I'm precise with my protein and fat. Yeah. So it might not, the stomach pain can be coming from other things, right? Could there be food sensitivities? Could there be dysbiosis? That kind of stuff as well. So you might want to, you kind of have to pay attention to some of those things as well. Decrease, reactivity as far as reactive foods go. But you don't want to do intermittent fasting. If you have adrenal problems, you don't want to do intermittent fasting. No way. So good luck. Melanie says, does magnesium glycinate taken before bed help one to sleep? Sometimes. If so, recommended amount, which I can't really give. Tired of waking up between 12:30 and 2:30. That's a common hypoglycemic time. And not being able to fall back to sleep. Okay. Blood sugar. So hypoglycemic diet, small frequent meals, minimally 3, sometimes 6, like a meal snack pattern. Small breakfast snack, small lunch snack, small dinner snack before bed. Even if you have a perfect snack before bed, your blood sugar is going to drop overnight. Everybody's does, right? But for most people, that's a minor stress. They generate a minor response and they sleep right through it. Not us. Not those of us with adrenal problems, right? Because we make mountains out of molehills, right? Our limbic system is sensitized, is trigger happy. Blood sugar drops, minor stress, major response. Now I'm wide awake just because my blood sugar dropped. So number one thing with regard to sleep is we got to balance that blood sugar, right? Now, a hypoglycemic diet is not a perfect diet for health and longevity. I agree with that concept, right? But if you have adrenal problem, it's exactly the way you have to eat for a long while, until we can tweak the diet and make it healthier. But hypoglycemic diet. So, typically, if you look at the research on ME/CFS, with regard to magnesium, accepted 300 to 500 milligrams of magnesium daily can help. I do like magnesium glycinate as one of my preferred magnesiums. When you bind magnesium with some kind of organic substance, like an amino acid like glycine, it tends to be better absorbed, and then you get the glycine benefit too, although it's not much glycine. But I do prefer those, and it's worth a try. By the time a lot of my patients have insomnia, right? So, when you're stuck in fight or flight, the stress hormones are going to cause damage. That damage is going to lead to a very typical set of symptoms: fatigue, pain, brain fog, insomnia, weight gain, anxiety, depression, blood sugar problems, blood pressure problems. Those are usually low in the beginning and eventually they go high. Predictably and documented in research that the number one cause of these things is going to be stress physiology. So let's fix the stress physiology. Everybody says, just take an anti-anxiety. But that's not going to do it. You're covering up a symptom. You might not see the symptom anymore, but you haven't fixed the underlying problem. It's like putting a piece of tape over the check engine light in your car. That's not going to fix anything. And it's going to get worse, right? It's going to get worse. So I don't know why I went on that tangent. I'm gonna move on. So fix the underlying cause of the sleep, right? Don't treat the symptoms. So I don't chase after symptoms. That's where I was going. I don't chase after symptoms. I chase after the broken physiology that is probably causing it. Shannon says, I'm trying to conceive and suspect I have adrenal fatigue. Can you explain how pregnancy ties into this? Okay. If you have adrenal fatigue, conceiving and carrying a baby is going to be challenging. Any mothers out there go through a pregnancy? Can you say that it wasn't stressful in any way? And then after you give birth, was that stressful, right? That's what adrenal problems are. Adrenal problems are a broken stress response system. So we know predictably what happens during pregnancy. Your body is going to jack up your stress hormones, right? We know there's elevated cortisol. You need elevated cortisol when you're pregnant. If your adrenals can do that, right? So if there's adrenal fatigue, are the adrenals going to be able to support you through pregnancy? Now, quite often, what I will see is when our physiology is stuck here with adrenal fatigue, again, that stress hormone suppresses immune, digestive. We talked a little bit about those. Immune, digestive, reproductive, and thyroid. Stress hormone suppresses the hypothalamic pituitary ovarian hormone axis, right? Just like the HPA axis, HPO axis. It suppresses it. And that throws off the periods, causes PMS, heavier bleeding, and all kinds. Sometimes the period skips a little bit, but that will also not uncommonly cause miscarriages and fertility issues, right? And numerous times, I've had women that were trying to conceive, and as we were able to shift this physiology, they were more successful in conceiving and being able to carry the baby through the pregnancy. So my advice would be to get ahead of the adrenal fatigue. And if you need help and assistance with that, we're here to help. I mean, that's what we do all the time. And if the fastest way to get ahead of this is to do a program with us. It truly is. If your biological clock is ticking, right? Then you want to tackle this, you want to get after it, we can help you, right? We can help you get after it. So if you're curious about the programs, you can, leave a comment below. Somebody can reach out to you. Again, we offer a complimentary call as well, but conceiving a child when you have adrenal fatigue is not going to decrease the stress in your life and kind of prolong things. So I'm always trying to deal with the adrenal problems before we do any of those kinds of things. Okay. All right. But all my best either way. Ashraf says, "Hi, Doc. It's been 30 months since my first crash. I've developed a certain fear for everything, going outside, meeting people, delaying a meal, doing tests. How can I train my brain to get rid of the fear since it brings back more stress and symptoms? How can I wake up and spend the day without thinking about symptoms and worries and all?" Yeah. So, this amygdala, Ashraf, this amygdala in our brain is good at fear and worry. That's what it does. It's trying to detect danger. And so it does it. And we then fill up our bucket and then we crash, right? There's always that straw that breaks the camel's back, whatever that may be, right? Which unfortunately is only the tip of the iceberg, basically. And then we crash, right? Now we're stuck here. And now the limbic system gets sensitized and trigger happy, right? Over perceiving its environment as dangerous. So fear and worry predominate. So the way to get through that is to retrain your entire stress response system. A lot of that trigger towards fear and worry is neurological, not necessarily psychological. That's why I'm not crazy about the words anxiety or depression. Do my patients have anxiety and depression? Yeah, but not from a psychological perspective. Now, we can make it worse psychologically. It's not that we shouldn't, understand what's going on and do therapy and work on your mindset and all those things. All those things are important, and we do all those things in our programs as well. But you also have to fix the nerves, because if you don't change those neural patterns, like, you're just gonna be trigger happy. So everything we do, I mean, literally everything we do, lifestyle, diet, supplementation, all these things, they're targeted at getting at that rewiring of that trigger happy stress response system, whether it's the HPA axis and the hormones, the autonomic nervous system, limbic system in the brain, and all that stuff starts with core. It really does. It really does. Ashraf, if you were able to do core alone, right, self-led, self-paced, right, so you do that on your own, that would help because it talks about all those foundational pieces and it gets to all this kind of stuff, right? How do we do it? So we want to do vagus nerve exercises, relaxation exercises. It could be a breathing exercise, meditation, nature, humming, gargling, mindset, cognitive behavioral therapy. All of that fixes it and rewires it. All right. Good luck. And other things like, tapping exercises, right? People do the tapping, like pattern interruption kind of stuff too, when we're triggered and challenging those things can work too. Okay. Jane says, how am I doing? Jane says, how can I get rid of muscle spasms, vibrations, and spidery feeling internal inside my legs? Is this adrenal fatigue? And what else do you suggest? Well, could be adrenal fatigue, just like every one of these symptoms, right? Symptom assessment tool, check the comments below, run the website, 4 or 5 questions, 5 minutes. It's quick and easy, right? Quick and easy, and it kind of spits out, could it be adrenal fatigue? I will say that we talked about central sensitization earlier, coming from stress hormone hitting the nerves. I don't care if it's the nerves in the brain, the autonomic nervous system, the peripheral nerves as well. When that happens, it makes those nerves trigger happy, and my patients develop weird nerve sensations that doctors will call paresthesias, weird numbness, tingling, itch, burn, pain. I mean, just weird random things. What also happens is that we've got adrenaline running through our system, right? And adrenaline in and of itself can make us, kind of, jittery and spidery, maybe that kind of thing. Now, muscle spasms might be a little bit different than vibrations and feelings. Like, you could have a couple different things. Muscle spasms also often come from mineral imbalances, sodium, potassium, magnesium, which we see all the time because, lo and behold, your adrenals control your sodium and potassium levels. Number one cause of muscle cramps. The adrenals, and only the adrenals. That's what controls them, right? And they also deplete some other minerals, calcium, magnesium, things like that. So it's that broken stress physiology. If you figure out that you have adrenal fatigue, that's what you gotta do. But check that assessment tool. Okay. Katerina says the difference between berberine and dihydroberberine. Dihydroberberine. I have no idea. Sorry, Katerina. That might be one for ChatGPT. Anonymous. Dr. Neville, is cancer an immune system issue due to stress? Having adrenal fatigue does suppress the immune system, specifically a certain part of the immune system that fights things inside cells. It's called your Th1, T helper cell, Th1 side of our immune system, as well as our innate immunity. Those do get suppressed with stress. And that is our checkpoints on cancer. So is there an association? Yes, for sure. Does stress cause all cancer? No, it doesn't. But there's a connection. Yeah, I'll leave it at that. Okay. Alice says, I've been dealing with adrenal fatigue for the past few years, and I've just been diagnosed with a tumor as well. Do you have any tips on how to recover as fast as possible? Yeah, so I'm not sure what tumor you're talking about, Alice. If you've been dealing with adrenal fatigue, then of course I'm going to tell you to fix that because, do whatever you have to do with regard to the tumor, whether that is, I don't know if that's adrenal tumor or what, but, you get assessed, right? Get assessed the right way, right? Go to an endocrinologist, go to an oncologist, whoever you have to go to get properly assessed and get recommendations. Get recommendations from conventional medicine. And if you're leaning towards functional medicine, get recommendations from functional medicine doctors as well. But if you have adrenal fatigue, our ability to heal is compromised. It's over here, right? Again, when we're in fight or flight, we're creating wear and tear in the body. That's my time. Can I get into that? So when the wear and tear, if I go a little deeper, the wear and tear comes from free radicals. So you know how a car has to exhaust as it's driving down the road, the car exhausts, right? Well, the way our cells exhaust when we're in fight or flight is we create free radicals, the result of energy burning, right? So we create these free radicals. Now, free radicals are little electrically charged molecules that get dumped into the blood. And they're like pinballs in an old school pinball machine. They fly around, bounce around, nicking and damaging tissue. Now, this is the blood supply. These are in the blood supply. So the blood supply goes everywhere. So this damage is literally everywhere, which is why the symptoms are all over the body, right? All systems, all cells get hit with this free radical damage. Medically, they call that oxidative stress. Oxidative stress connected to just about every chronic condition, disease that you can think of. So that's the wear and tear. That's where that comes from. But when we're creating that wear and tear and we're stuck in fight or flight, we're suppressing this healing and repair side. And when we're suppressing the healing and repair side, I mean, again, we don't heal and repair. That's what rest and digest is about, is to help us to heal and repair, to help. When we turn on that physiology, it tells the cells that it's time to heal. The cells receive, I'm going to call epigenetic signals, right? Meaning signals, chemicals in the body that trigger certain gene expression of healing and repair. Now that cell is not geared up for battle. That cell is geared up for cleanup, right? Turning on autophagy and mitophagy and just cleaning up all the garbage. It's like a manufacturing plant that's been going full tilt 24/7. Gotta go. Nobody's taking out the garbage. Everything's a mess, right? Well, let's clean that place up. And that is key. I mean, that is what healing's about, especially on a cellular level. So shifting this physiology helps us to literally heal from anything. It's so incredibly powerful. Yeah, I don't know if that helps at all, Alice, but good luck with everything. Lara says, I took your online assessment and it said I have adrenal fatigue. Is there a diagnostic test for this? Well, there is, Lara. So the way you want to test for this is through saliva testing. Now, I use one particular lab that we've been using for over 20 years. They originated this testing. They do it better, more comprehensively and more accurately than any other testing that I've seen. So there is saliva testing. You want to get a 4-point saliva test, which measures cortisol and some other adrenal hormones, DHEA, 17-OH progesterone. The test that we run is a 10-point test, which I like. Some of the others are only like 4 or 5. So we need that comprehensive test. And that's the test that we do in our programs. We run that test. But not only do you need the test, you need the proper interpretation of the test. And I cannot tell you how many times I have seen people come in with old test results from a practitioner who misinterpreted those results. And you think this would be easier, but there's nuance here. They misinterpreted the results years ago and mistreated the patient. And, now it's 2-3 years later and, they're not any better. And they had the chance, right? The doctor knew to actually run the test, and then misread the test and didn't guide the patient in the right way. Now, some other doctors will, they'll say, "Oh, you have mold, you have SIBO, you have hypothyroid, and you have adrenal fatigue." Like they're all on the same level. They're not. These are not on the same level. Once somebody finds that they have adrenal fatigue, you got to go full stop and fix that, because that problem is a broken stress response system. And that stress response system controls your entire physiology. I cannot emphasize that enough. It literally controls your entire physiology, because when it has to, right? It has to. When we're in fight or flight, the body thinks there's a tiger. So what's going to happen? Turn on the heart, turn on the lungs, turn on some sugar metabolism for fuel. We need those. Those are going to save us. We need glucose, we need oxygen, and we need blood to pump it to all the muscles and all that stuff. And then shut everything else off. All right, that's life-saving. Do that once in a while. That's life-saving. That's what you want. Do that too much, now you're going to overwork these organs and burn them out, and you're going to suppress all the healing and repair organs. You're going to have all kinds of secondary and tertiary problems in those systems. That is what has to be tackled for sure. So, yes, there's a diagnostic test. Sorry, I forgot where I was. I don't know how I got there. Diagnostic test, saliva testing. That's the testing we do in our programs. Again, the testing, proper assessment. That's really the key. Now, so I mentioned the programs, right? So when I'm talking about the programs, there's core, right, which is the base, the foundation. Then I have 2 active programs that I use on top of that with added support. One is called Core Plus. That's with my coaches. So, and then the second one is with me. You know me. So I want to talk about my coaches. My coaches know more about adrenal fatigue than any doctor you can go to. Guaranteed. Because they've been patients. They've been through the program, my programs. They've healed on their own journey. And some are still healing even, right? Just not way down here. They're up here, and now they're working with me on our mission to heal everybody with this thing. And they had coach training, nutrition training prior. And I put them through my 12-week adrenal health coach training program, specifically with regard to the way my experience, 23 years treating over, I don't even know, 7,000 plus patients in doing this day in and day out. Not on the internet. I know I'm kind of on YouTube now and all that stuff. No, I have patients in front of me, right, day in and day out, and we've been able to help them incrementally get their lives back, literally get their lives back. My coaches do that day in and day out. That program is 3 months. The program with me, with a little more, if it's a more complicated case, then I take those patients. But these programs work phenomenally well. That's where you find the testing. Okay. Sherry says, I've been taking 30 milligrams of pregnenolone for a couple months. My menstrual cycle is a couple weeks overdue. Having crazy dreams. I stopped the supplement and we'll start back at 10. Curious if the dreaming menstrual irregularity is normal. Well, it's not normal. It shouldn't happen. Pregnenolone is a hormone, right? It's an adrenal hormone. It's a precursor hormone to all your adrenal hormones. Sorry, just checking my time. Then could it happen? Possibly, right? Possibly. My patients are on the sensitive side, right? So, we react a little differently. I love pregnenolone. It's my favorite hormone, and I use it all the time. But the different things work for different people, right? So you're doing the right thing. You want to, if something goes off, could it be connected? Maybe. When in doubt, leave it out, and then you kind of retry it and see what you notice. If it does, you shouldn't have any side effects. At least in my programs and from what I do, I want no side effects from anything. That's why I always make one change at a time, right? And I go slow with everything. I've got a method that I've developed that works for patients. So make sure you're, always one change at a time. Listen to your body. It shouldn't throw things off. Pregnenolone is also it's active in the brain. It does hit some neurotransmitters in the brain. So the answer is, I guess, maybe. I think I got through them all. I don't know. My team will talk to me about that. I'm not sure. Last plug for Core, because it works, $497 and $30 off, right? $30 off if you heard about it today and you put, I don't know, go in the comments. I think there's a coupon code or something like that. It is the foundation for what I do, and it works. And it works. Even if you check out the page and look at the testimonials, look at the reviews for what it does. Even some of my coaches, we just hired a couple new coaches. They started with core, and now they're incrementally working their way through and better and continuing to get better. It really is the foundation of what we do. All the programs are set up that way. So it is fantastic, and it helps, and it works. It works. So I guess I would say if you followed along and you nodded your head and some of this stuff made sense, reach out, keep learning, go to the YouTube channel. But if you want help and guidance, and it's okay to need help. It really is. I mean, I'm a DIY guy myself. I try to learn some things on YouTube. You can get information on YouTube, but you can't get personalized guidance and support through the ups and downs, which are inevitable in healing from this process, right? You can't get that kind of personalized care, guidance, and support from videos. I mean, that's what we offer, and we do it really well. So don't hesitate to reach out, okay? Thanks for showing up. Hope you learned some things, and we'll talk next time. Take care.